Hi, the next issue we're going to be looking at is something that I call Heal Thyself, Doctor. My favorite example of a borderline character in pop culture is Dr. Gregory House on the hit series TV show from Fox called House. My favorite movie about a borderline is The Cable Guy. Dr. House is a well-known infectious disease and kidney specialist who takes on challenging cases solving impossible medical mysteries. He abhors people but adopts these cases because he loves puzzles, and every human body is basically a mechanical mystery or a moist robot, as a philosopher once said. If humans are moist robots, then perhaps God is a dry human. House has many assets, including his high intelligence, a well-respected career with good remuneration, and a best friend who is loyal to a fault, his Dr. Watson. Dr. House suffers from chronic pain syndrome due to a leg injury caused by an infarction that went undiagnosed for 3 days until he diagnosed it himself. Dr. House is miserable, and it is heart-wrenching to watch him contend with his physical and psychological pain, loneliness, and how he sabotages his life in various ways year after year. In fact, he abuses various drugs, mostly analgesics, but others as well, has an erratic mood and unstable behaviors, burns through personal and professional relationships, and, while perceptive, has poor insight into his own issues, though he does recognize his desultory situation to some extent, and later in the series refers to himself as the most miserable person in the world. It is painful to watch, but also very instructive, as the series is a riff on the adage, physician heal thyself. There is a very good episode where a psychopath challenges Dr. House to consider if he isn't also a psychopath, given his complete disdain for other people, suggesting for the first time in the series the possibility of a psychiatric diagnosis or perhaps a differential diagnosis. There are several interesting aspects to Dr. House. First, he's completely misdiagnosed. He is seen as a drug-addicted narcissist, but BPD is never once mentioned in the series, even though he's surrounded by doctors, including psychiatrists, in a premier medical center. Second, Dr. House suffers from unbearable physical and psychological pain. Neither is adequately addressed through pharmaceuticals or otherwise. Dr. House is misunderstood, misdiagnosed, and mistreated. Sound familiar? Many borderlines probably recognize that their psychiatric and personal issues have not been properly identified or misunderstood by healthcare professionals, including their primary care physician who has known the person for many years. Dr. House does a lousy job diagnosing himself and self-medicating. However, the sad truth is that the healthcare experts who surround him are no better at pinpointing his problems, and therefore Dr. House's unconventional methods of attending to his symptoms may ultimately be necessary because no one else seems to truly understand him. What's particularly interesting is that Dr. House is an open book and neither holds back voicing his thoughts or feelings, no matter how inappropriate, so that the doctors who surround Dr. House do not have to guess what he's feeling or thinking, and his impulsive behaviors are also available for everyone to see, and yet Dr. House remains undiagnosed and very ill. As such, self-advocacy and even self-treatment may sometimes be appropriate and even necessary when, after years of being surrounded by healthcare professionals, little progress is made. And that's why we're going to look at the next episode, Anticipate Positive Change as You Age.